Hello everyone, welcome to the Medic World Study with Dr. Mahi. Today we will discuss previous year questions of orthopedics from AIMS 2018. So our first question is, the X-ray image of a patient that presented to the casualty is given below. How will you manage this case? So first of all, we have to identify the X-ray or the radiograph given. Here in the radiograph, we can see this is the femur, this is the tibia, and this is the fibula. And the bone in front of all of this is the patella. And we can see there is displaced patellar fracture. And we all know that patellar fracture is managed by tension band wiring. So the answer to this question is option C, that is tension band wiring. Let's move towards the other question. A 55-year-old female patient presented with a flexion contracture of the hip. Which of the following tests is useful in the diagnosis? We all know to diagnose the flexion contracture of the hip, the test which is useful is the Thomas test. So the answer to this question is option C, that is Thomas test. Let's move towards the other question, that is, a 10-year-old came to the OPD with the following deformity of his left upper limb. What is the most likely cause of fracture? Here we have to identify the deformity first. This is the deformity that is known as the cubitus varus deformity. Here the forearm is deviated medially. The forearm is deviated medially as in relation to the upper arm, which is this cubitus varus deformity is a common complication of supracondylar humeral fracture. So the answer to this question is supracondylar fracture because they are asking the most likely cause of the fracture, and supracondylar fracture complicates as cubitus varus deformity if left untreated. Let's move to the other question, that is, a 4-year-old child was brought to the OPD with painless deformity. Painless deformity. A radiograph of the child's leg is shown below. The most common cause of this deformity is. So, here we can see in the X-ray that is bow legs, or we can say it as genu varum. These legs we can see now. This is genu varum or bow legs. Means all these clinical features and radiograph points towards the diagnosis of rickets, that is a bone mineralization disorder which is primarily affects the children with open growth plates resulting from the deficiency of vitamin D, calcium and phosphate. Vitamin D, calcium and phosphate. Let's move towards the other question. A 25-year-old man involved in a fight injured his finger, and the deformity is shown in the following image. X-ray is normal. The most appropriate management at this stage is based on the mechanism of injury and deformity characterized by hair in the deformity. We can see there is flexion at the distal interphalangeal joint along with normal radiograph, which points to the diagnosis X-ray is normal to the so we can diagnose this case as mallet finger. And we all know that it is managed by splinting the finger in hyperextension. So the answer to this question is option D, that is splinting the finger in hyperextension. Let's move towards the other question. What is your diagnosis from the below X-ray image? This is the image given. From the X-ray, we can identify this as a giant cell tumor or osteoblastoma. So the answer, this is no soap bubble appearance is seen here. at the wrist joint, which points to the diagnosis of giant cell tumor. So the answer to this question is option C, that is giant cell tumor. Now, next question is which of the following is true regarding the scar tissue in patellar-Klunk syndrome? In patellar-Klunk syndrome, the scar tissue, which is formed at the superior pole of patella and becomes impinged during the knee extension. So, C and D is cancelled because it is in the inferior pole of patella. And the answer to this question is option B, because it is in the superior pole of patella and impinging during extension. So the answer is option B. Then the next question is the earliest symptom of acute compartment syndrome is. The earliest symptom of acute compartment syndrome is pain, which is not responsive to analgesics given. Now, the next question is identify the following marked structures. We have to identify these structures marked 1, 2, and 3. First of all, we have to diagnose the case. This is the case of chronic osteomyelitis, and this is cloaca, this is involucrum, and this is the dead bone in the center, that is sequestrum. Let's find the answer. One is involucrum. So one is involucrum. We can find the answer. That is option C. Two is cloaca and three is sequestrum. Let's move towards the other question. That is, which tumor does not cause osteomalacia and phosphaturia? Breast cancer does not cause osteomalacia and phosphaturia. So the answer to this question is option B. Now, the next question is polytrauma patient with femur fracture, health, and massive hemorrhage presents to the emergency department after a road traffic accident. Which of the following is not an immediate treatment consideration? The patient presents with femur fracture and massive hemorrhage. Now, which is not an immediate treatment? Administration of IV crystalloids is true. We can consider it as the treatment option. Administration of tranexamic acid is also true. Check coagulation with thromboelastography is also true. But internal fixation of femur fracture is not done immediately in case of femur fracture and massive hemorrhage. So the answer to this question is option D, that is internal fixation of femur fracture. Now the next question is what is the most common form of arthritis? And the answer to this question is osteoarthritis is the most common form of arthritis. That is option D. Now, let's discuss the questions from AIMS 2019 of orthopedics. So, the first question is following a fall in the bathroom, an elderly lady is diagnosed with a fractured neck of femur. Fractured neck of femur. Which of the following coexisting conditions is most likely to have predisposed to this injury? We can see that falling a fall in the bathroom means a trivial fall, means not such a large trauma, but a small trauma can cause has caused caused fractured neck of femur. So it may be the case of weak bones, and weak bones are there in the elderly lady. Weak bones points towards the diagnosis of osteoporosis. So the answer to this question is option A, that is osteoporosis. Now the next question is at what age in a woman is a DEXA scan done routinely? The answer to this question is 65 years of age. At 65 years of age, DEXA scan is done routinely in a woman. Now let's move towards the other question, that is most specific feature of ankylosing spondylitis. HLA-B27 positive. It is not the most specific feature because it may be present, it is present in most of the patients, but it is not present in all the patients. So it's not the answer. Bilateral sacroiliitis, it is the correct option. It is the most specific sign of ankylosing spondylitis. Now, the next question is the treatment for the condition given is. The condition given here is a expansile eccentric subarticular lytic lesion in the epiphysis of distal femur. Okay, with a soap bubble appearance, which points towards the diagnosis of giant cell tumor. So, the management of giant cell tumor is extended curettage with autograft. So, the answer to this question is option D, that is extended curettage with autograft. Now, the next question is identify the instrument given below. In the diagram, we can see the instrument that is a bone nibbler. So the answer to this question is option A, that is bone nibbler. Now, next question. A 30-year-old man presents with numbness of both hands. He was asked to perform the test demonstrated below. What is this test? We know this is the Roos test where the both the arms are elevated. Elevated arm test is the Roos test. So the answer to this question is option D. Option C, sorry, that is Roos test. Now the next question. The test performed below is. We can see here the test which is performed is the Allen's test, which is used to test the adequacy of ulnar collateral blood flow to the hand, which is usually done prior to radial artery cannulation. So the answer to this question is option A, that is Allen's test. Here we are checking the patency of this ulnar collateral blood flow to the hand. Now let's move towards the other question. A child presents with difficulty in walking. On biopsy of hip, some cells are with grooved nuclei. Okay, difficulty in walking. On biopsy of hip, some cells with grooved nuclei and eosinophilic cytoplasm are present. Which investigation would you offer next? Histopathologically, cells with grooved nuclei and eosinophilic cytoplasm can be observed in both Langerhans cell histocytosis and chondroblastoma. Therefore, the next step to differentiate between them would be to obtain a CD1A marker, which is typically positive in LCH. So the answer to this question is option D, that is CD1A marker is present in LCH only. So to diagnose the case, we have to do CD1A marker because grooved nuclei and eosinophilic cytoplasm can be present in LCH as well as chondroblastoma. Now the next question. A 28-year-old man has recently finished a half marathon. He complains of pain along the anterior and medial aspect of tibia, which increases on jogging and walking for a long time. Pain along anterior and medial aspect of tibia, which increases on jogging and walking. Plain X-ray radiograph of the leg was found to be normal. What is the probable diagnosis? As per the clinical scenario given, we can diagnose this case as shin splint. Now let's move towards the other question. That is, the following X-ray shows a lytic lesion of the limb. The biopsy shows fibroblastic proliferation, osteoclast, and inflammatory cells. Lytic lesion of the limb we can see in the X-ray. Biopsy shows fibroblastic proliferation, osteoclast, and inflammatory cells. From the given options, the most likely diagnosis that can be inferred from the above clinical picture. The provided X-ray reveals the lytic lesion in the epiphysis of distal tibia, and the biopsy, which shows osteoclast cells, suggests the diagnosis of giant cell tumor. So the answer to this question is option B, that is giant cell tumor. Now the next question is, which of the following is used to stabilize a fracture of distal femur as shown in the image below? We can see in the image, this image is showing the rail fixator. So the answer to this question is option A, that is a rail fixator. Now the next question is, what is the type of scoliosis shown in the image given below? In the given radiograph here, this is the given radiograph. The presence of single hemivertebra at P9 and concavity to the right in the lower thoracic region is suggestive of congenital scoliosis. So the answer to this question is option A, that is congenital scoliosis. Now the next question is, the following instrument is used for. The image is showing the bone holding forceps, and it is used for holding the bone and plate. No rocket science. Now, the next question is, a patient presents to the emergency department after he on his outstretched hand. Fell on his outstretched hand. An X-ray was performed and given below. What is the diagnosis? Here in the X-ray, we can see the oblique fracture in the lower third of the radius and dislocation of distal radioulnar joint. Here, this is the radius, and where here we can see the oblique fracture in the radius, and dislocation of distal radioulnar joint is dislocated, which points towards the diagnosis of Galeazzi fracture. So the answer to this question is option C, that is Galeazzi's fracture. Now the next question, identify the following device. This device, which is shown in the image below, is the cock-up splint. So the answer is option A, that is cock-up splint. Thank you so much, guys, for having patience and listening me out. All the very best. For any queries, you can contact me on the email address displayed on the screen. Thank you so much.